Ladies and gentlemen, thank you so much for joining us this morning. I'm Anita Huberman. I'm CEO of the Surrey Board of Trade and an honorary captain of the Royal Canadian Navy. Thank you for attending today's event, so important to our city. And of course, as everyone knows, Surrey is going to be the largest city in British Columbia by 2030. And the topic of new infrastructure investments in our city is so exciting because it means innovation, economic development, and new opportunities and new jobs as well. The new hospital in Surrey and a dialogue with BC's Minister of Health is so relevant today because never before have we had during the pandemic healthcare, business, and government working so closely together. And ladies and gentlemen, this event is co-hosted by the Cloverdale and District Chamber of Commerce and the South Surrey White Rock Chamber of Commerce. Ladies and gentlemen, I just wanted to mention just a couple of things before we start. And that is this past weekend, we supported, and we have been supporting for the past 10 years, a Canada-India networking conference. And I know our presenting sponsor, Simon Fraser University, has been at the forefront of that with us through our SFU India Advisory Council and through her president's advisory council as well, to ensure that we have the technology, the innovation, the preventative healthcare mechanisms to drive not only international opportunities, but also local opportunities as it relates to healthcare. And it's not only related to the South Asian audience. 104 different languages are spoken in our city. And this conference last weekend, where BC's Minister of Health was present, is an ongoing recognition of the need for domestic and international partnerships as it relates to healthcare. And we're certainly going to see that with the new hospital in Surrey and a leading edge, very tech oriented way in terms of looking at cancer treatment and really a best in class tech innovative center that's going to exist in our city. So, ladies and gentlemen, I'd like to acknowledge that we are on the treaty territory of the Tsawwassen First Nations and the unceded territory of the Coast Salish peoples, specifically the Kwantlen, Katzie, and Semiahmoo First Nations. I'd also like to acknowledge during this Indigenous History Month that we are also on the land of the Inuit and Métis people. Never before do we have the opportunity to learn, reflect, and come together, even for this upcoming Canada Day. Events like this do not happen without sponsorship. Thank you so much again to our presenting sponsor, Simon Fraser University. Our business and international trade center sponsors are the law firm of Fasken, the Chambers of Commerce Group Insurance Plan represented by SNF Benefits, BDC, the Business Development Bank of Canada, and Scotiabank. Government officials that are with us on the Zoom technology call today are Shanjaleen Davidi on behalf of Tamara Johnson, MP for Cloverdale Langley City. Anisha Virk on behalf of Carrie Lynn Finley, MP for South Surrey White Rock. Harry Baines, MLA for Surrey Newton and BC's Minister of Labor. Gary Begg, MLA Surrey Guildford. Jagrup Brar, MLA Surrey Fleetwood. Representing Stephanie Cadu is for MLA Surrey South Surrey is Kieran Dhaliwal. Representing Trevor Halford, MLA Surrey White Rock is Effie Cerise. Jenny Sims, MLA for Surrey Panorama. Rachna Singh, MLA Surrey Green Timbers, and she's doing amazing work as it relates to combating racism and hate in all of British Columbia. Representing Mike Starchuk, MLA Surrey Cloverdale. Representing him is Nazik Sabarwal. His Worship, Darrell Walker, Mayor of the City of White Rock, and our City of Surrey councilors, Linda Annis, Brenda Locke, and Stephen Pettigrew. Thank you so much for joining us. Ladies and gentlemen, all attendees are muted. If you do have a question, please put it in the chat function of the technology, and we will get to it during the question period. If we're unable to get to your question, we'll send you the answer by email after the session is over. And now, it's my pleasure to welcome the president of Simon Fraser University. Actually, my apologies. I'm going to first announce our co-host partners. Please help me welcome Scott Wheatley. He's the executive director of the Cloverdale District Chamber of Commerce. Scott, over to you.
Thank you very much, Anita. We truly appreciate the opportunity to co-host today's event with our colleagues at the Surrey Board of Trade and the South Surrey White Rock Chamber of Commerce. I'd like to thank Minister Dix for taking the time to speak with us. This new Cloverdale Hospital is one of the most anticipated developments to come to our area for years. And as the Chamber representing Cloverdale, we want to thank you for speaking with us today, as really, truly, this is the most talked about development in the area and one of the most often asked questions of me in my role here. So thank you very much again, Anita, and we look forward to listening to Minister Dix.
Thank you, Scott. And now, please help me welcome Ritu Khanna. She's the Executive Director of the South Surrey White Rock Chamber of Commerce.
Thank you so much, Anita, and Health Minister Adrian Dix for taking the time for today's session. The new Surrey Hospital located in Cloverdale is a welcome and much needed addition to the healthcare infrastructure in the region. Representing South Surrey and White Rock, it is a community that is quickly growing, and the demographic footprint will look very different 5 years from now. As you know, the Peace Arch Hospital has played a critical role in providing health and emergency services to our local community and to residents throughout Surrey and beyond. It is also an important healthcare hub for medically related professionals and businesses. As investment begins in the new hospital, we want to ensure that the investment continues in the needed and continued expansion of Peace Arch Hospital, and the services and efforts are coordinated among the three hospitals within the Surrey and White Rock borders, as each one will play an important role to serve the healthcare needs of all residents and many businesses. Thank you.
Thank you, Ritu. And now please help me welcome our presenting sponsor, Dr. Joy Johnson, President of Simon Fraser University. Joy?
Well, thank you so much, Anita. Let me begin by acknowledging that I'm privileged to be speaking to you today on the territories of the Semiahmoo, the Katsi, the Coquitlam, the Kwantlen, and the Kaikwat and the Twasan Nations. I want to thank the Surrey Board of Trade, the Cloverdale Chamber of Commerce, and South Surrey and White Rock Chamber of Commerce for organizing today's event. I want to welcome our distinguished guests, and I hope you're keeping safe and well. True to our vision as Canada's most community engaged university, a key area of strength for SFU is our ability to innovate and to engage with partners across sectors and to support our students and our communities. And Anita, I'm so glad you mentioned that conference that took place this past weekend. I'm glad to see Aaron Gars with us today. Just been such a champion of thinking about partnerships with India in the healthcare space. With significant new resources from the government of BC, SFU has invested substantially in expanding educational and research opportunities on our Surrey campus. These investments have had a profound and really positive impact for SFU, but also for the community as a whole. We're committed to further expansion of our Surrey campus with new programming in areas such as health and agritech. SFU health programs really are highly interdisciplinary with a strong focus on public health. We've an accredited programs in public health, and our most recent program is a new MSc in Indigenous population health, an area that I think we can all agree is very important. We were so pleased to see the opportunity for a second BC medical school in the mandate letters of the Minister of Health and the Minister of Advanced Education and Skills Training. And SFU has been working with Fraser Health and the First Nations Health Authority on the vision of a distinctive community engaged medical school focusing on training primary care physicians. Throughout the pandemic, our health and science faculty members with expertise in epidemiology, global infectious disease governance, and cross-border pandemic response have provided expert advice to both levels of government and made themselves available to media in BC and around the world. Now, it's really my great honor to introduce our keynote speaker for today, BC's Minister for Health. Minister Dix has served as the Minister of Health for close to 3 years and has championed a primary care strategy for the province, putting communities and health professionals at the center of primary care transformation. He's also been instrumental, along with Bonnie Henry, as we all know, in steering the province of BC through the challenging COVID-19 pandemic. We are not yet through the pandemic, but the leadership in BC and the work of public health and health authorities has been commendable. So thank you ever so much. Minister Dix is also, some of you might not know, serving as the current minister responsible for the Francophonie and for Francophone Affairs in British Columbia. And he's also obviously the MLA for Vancouver Kingsway. Prior to becoming an MLA, he was an executive director for Canadian Parents for French, BC Yukon branch, and a nonprofit organization promoting language education. He is, as many of you know, because you've heard him speak French, bilingual, and has been a significant champion for French language-based education and supporting the training and development for French language teachers here in BC. Minister has been crucial in advocating to help secure funding for SFU's Office of Francophone and Francophile Affairs, and we're grateful for you. For that support. Ladies and gentlemen, I don't want to spend any more time talking about Minister Dix. I know you're anxious to hear from him, so please join me in welcoming the Honorable Adrian Dix.
Thank you, and thank you very much, Dr. Johnson, for that introduction. I just make one correction. You know, it's been 4 years, and I only say that because almost 4 years, because this 4th year has been really extraordinary, obviously, for everyone involved in healthcare in BC. I have had the distinct honor to be Minister of Health and worked with people around British Columbia, but particularly in Surrey, and I want to talk about that in a second, in responding to the COVID-19 pandemic in our province. I'd like to, of course, recognize that you and the Surrey and Cloverdale and South Surrey White Rock, the Board of Trade and the Cloverdale and South Surrey White Rock Chambers are on the territory of the Katzie, of the Kwantlen, of the Coquitlam, of the Semiahmoo, and the Tsawwassen First Nations. Also, I'm in East Vancouver in my constituency office on Joy Street, and I'm in the territories of the Musqueam, of the Squamish, of the Tsleil-Waututh. I want to express a shout out to my colleagues. A lot of them are here. Feels like a caucus meeting. Harry Baines, Gary Begg, Group Brar, Ginny Sims, Rachna Singh, and to all the representatives, including Linda and Brenda and Stephen from the City Council in Surrey, all of the elected people, and those representing my colleagues, my other colleagues, Mike Starchuk and Stephanie Kajua and Trevor Halford, and Bruce Ralston. I think that I want to talk a little bit informally about healthcare in Surrey and why what we're doing now is so important. But I want to start by expressing my gratitude to our 3 sponsoring organizations, our hosting organizations, and the business community in Surrey, the community in Surrey, because everybody knows that the COVID-19 pandemic has hit Surrey hard. But what has also happened is a transformative and community effort of public health care, working with community and organizations such as you, such as the 3 business organizations in question, but also churches and gurdwaras, mosques, and everyone in the Surrey community to especially advance immunization. More than 80% in our local health areas representing us today, the Surrey local health area, the South Surrey White Rock local health areas of adults have been immunized, and close to 78% of all those over 12, above the provincial average, and significantly, I think, because of our joint and commitment and effort. And so I want to express my appreciation to you, but also to the healthcare workers and to the people of Surrey, and because my friend, his worship, Darrell Walker, is here of White Rock as well, for all their work together in dealing with the pandemic. And I think, as Anita said in her opening, what this pandemic has shown is the profound connection between public health care and economic life. Nothing could show it to us more, but in fact, this was apparent even in advance of the pandemic. I love the city of Surrey, and it is well known, and I've been involved in it and engaged in it in my public life, and it is, of course, an extraordinary, growing, dynamic, young community, and but it demonstrates, I think, the central importance and focus on healthcare that I think Premier Horgan's government has put in place. When I became Minister of Health, significantly, I think, Surrey was under-resourced in terms of healthcare. Some of the highest wait times for diagnostics and surgery in the country, a relative lack of services. We know that the land for the second hospital had been sold. And across healthcare, the people of Surrey, and often there wasn't as much of a focus on Surrey because, as I said, there was a young community. There tended to be a greater public focus on education and on healthcare. But the people of Surrey had been generally, and Fraser Health had been generally underrepresented. In fact, if you look at the number of beds, acute care beds per capita in communities, Fraser Health in its in totality, and Surrey was underrepresented compared to virtually any similar local health area in the country. So what did we do? We brought change, and that's an important consideration. But I want to make two more points about it before I talk about that change and talk about the second Surrey hospital. The first is that healthcare, compared to the competitive jurisdictions we have, Washington and Oregon and Idaho in our area, is a significant competitive advantage for business. The fact that we have public health care, and then that public health care cost is borne through the tax system, of course, and through our government, our collective effort, but is integrated, has shown its merit during the pandemic, of course, in countless ways, but also is a competitive advantage. Secondly, that healthcare with your health and technology community and business center in near Surrey Memorial Hospital is an important economic life in the community. So it provides a competitive advantage, and it's important in the economic life. But there is a lot of talk about the transformation of Surrey, and more than 1,000 people a month come to the community. That's more than 100,000 a decade, and that's not just this decade, but the past decade and the one before that and the one before that and the ones coming ahead of us. But what's changing, I think, and what's going to change in the coming decades, and why we have to make these investments in healthcare now, and I'm going to detail what those have been. And then before I talk about the hospital, the reason we have to make those investments now is that Surrey itself is inventing and reinventing itself all the time. It is now the youngest community in the province, but what you're going to see in the coming decades is a significant increase in the population of our elders in the Surrey community. And I just want people to understand this in context. Over the next 20 years, in the Surrey local health area, which represents almost all of Surrey, 42% increase in the overall population is expected in that period, which is substantial, of course. But that number between 60 and 79 is roughly 76%. And the number of people over 80 in Surrey is going to increase in the next 20 years by 239%. And this is critically important to all of our planning for the future of Surrey. Surrey is going to come back to the pack in terms of age distribution over the next 20 years. And as we know, we consume and we need healthcare services more as we grow older, a 239% increase in people over 80. And just to put the numbers in context, that's from 12,700 to 43,000. What that means, of course, is more demand on long-term care. We're adding, of course, a care home with PICS, and we've substantially increased care standards across our province. A significant increase in cancer. Across BC, we're going to see in the next 20 years a 50% increase in the number of people with cancer in our province. Why? Because life expectancy is extending. Why? Because age-related cancer in a society that is getting older is going to be a more significant factor. And that is doubly so in Surrey, where those populations are dramatically increasing over this period of time. So we need to invest in healthcare for Surrey now, and we're doing it, but we also have to build for the future. And that is what the second hospital is in part about. So I want to talk about what those things are, what we've done, because I think it's important that we tend to view healthcare as hospitals. We have a hospital, we don't have a hospital, we have a new hospital, we don't have a new hospital. But in fact, of course, the most important thing in healthcare is keeping people well in community. And that's why we've added the 2 urgent and primary care centers, one of course on 37A Street, one on King George Boulevard. 2 urgent and primary care centers, a nurse practitioner led center, I'd say, Scott, in the heart of Cloverdale, Access Primary Care, which is serving people in that community. The urgent care mental health center that is in place at Surrey Memorial Hospital, mental health and substance use urgent response center there. 3 new MRIs in the community, including, of course, the MRI clinic on 192nd Street and additional MRIs at the Jim Pattison Outpatient and Surgery Center in Surrey. And of course, the PICS development, the PICS Diversity Village development, which we promoted because, of course, as our population ages, so will the diversity of our elder population and the need to provide culturally appropriate care. And of course, a new primary care network coming, a raising of standards in our seniors care across the board, especially staffing standards. More than 90% of our care homes in BC were under standard when I became Minister of Health. Now that has changed, and that's changed in particular across Surrey. So primary care, seniors care, diagnostic care, mental health and addictions, and of course, because Surrey is an important center and is one of the most important Indigenous communities in all of BC in terms of number of people, our new Indigenous primary care and wellness home, which we've done in concert both with the community in Surrey, the Indigenous community in Surrey, but also with the First Nations Health Authority. So that's what we've done. And what do we need in addition to that? Well, we need a second hospital. And so all of you will know that the decision had been made previously, prior to the 2017 election, not to proceed with a second Surrey hospital. In fact, the land that had been purchased for that purpose had been sold. And you know, we often have debates about this: who and what position each different sides in politics have taken. That was just the reality we faced, and I give a lot of credit to the Fraser Health Authority because, in fact, that was the direction. And so when I became Minister of Health, there was really no plan in place to build a second Surrey hospital. So we started immediately, and you will know, in December of 2017, announced concept plans to work on a new Surrey hospital. And in December 2019, we announced the approval of the concept plan for that hospital. What did that mean? That the money was there in the 10-year capital plan, and we were proceeding. Then in the summer of 2020, in the midst of the pandemic, the planning was taking place. We were going to add to this extraordinary project, this new project, because we are building, as you may know, hospital projects across British Columbia. But in particular, what makes Surrey unique is that it's a greenfield new project. It's not a replacement project for that generation of hospitals that we built in communities in the 1950s and 1960s that need to be replaced and expanded and transformed. We needed a new hospital in Surrey, and that makes this project unique in all of British Columbia. We decided, because of those things that I was telling you about, because of the significant increase coming in cancer diagnosis, and that is not bad news. That is the result of us living longer, in fact. What we decided to do was add and approve a concept plan for a cancer center, which would be attached to a Surrey hospital, because the second Surrey hospital, because the opportunity to build a new hospital and fully integrate a cancer center was not something that we could miss out on. And you saw in the budget, of course, the approval of the business plan for the new second Surrey hospital, and the money figure attached to that, which is $1.66 billion. I want to put that number in context. That is the largest provincial contribution to a healthcare project in the history of British Columbia. And what it will mean in the heart of Cloverdale, Scott, I would say, in the heart of Cloverdale, a second Surrey hospital. And it will be part of a network, of course, of hospitals, including Surrey Memorial Hospital, which is a significant and important hospital in our province, to say the least, but also the upgrades at Langley Memorial Hospital, which serve many people in the eastern side of Surrey, the upgrades at Peace Arch Hospital that serve people in the south and western part of Surrey as well. Cloverdale is ideally situated as a location, and the location selected and is a significant location because it, of course, connects us with Kwantlen and that community there, and in fact meant that we were providing the resources to another important institution, the cost of the land going forward. And there's all kinds of development applications going on right now, starting right now with the city of Surrey, but meant that as we were paying out those costs, of the significant compensation, or that the cost of the land would go to another public institution that was in fact serving Surrey and would help us produce the healthcare workers we need for the future. So a second Surrey Hospital and Cancer Center. And it's a very significant project. As you know, we'll be going soon to the city of Surrey because we have some work to do there. And it's good to have councillors on the line who I believe will be extremely supportive in that process. The business planning continues, and we will soon be going through the tendering process, the request for qualifications and the request for proposals, while we do further consultation with the community on what the hospital will look like. But I think what you're going to see is a state-of-the-art modern hospital with services that will assist the community and work in concert with Surrey Memorial Hospital. You'll see a cancer center that meets the demands of the future of the community in Surrey, and will make an enormous difference and mean that many people in Surrey who many are served, of course, now at Surrey Memorial Hospital for cancer treatment, but many have to go outside of the community. That if we're going to see a need in terms of radiation therapy and in chemotherapy and other areas for treatment, that it should happen, that it can happen in communities around the province. And it's why we're looking at new cancer centers, and we're developing a cancer center in Burnaby, one in Surrey, in addition to our existing ones. And we're looking, of course, and we're moving forward in other communities, such as Kamloops and Nanaimo, because if we need to increase capacity, I think it's important to do that where people live around the province, rather than centralizing it in one place in Vancouver, so that people have to travel to us rather than us being closer to them. So those are the developments, and that's the context of the Surrey Hospital. And improve primary care, improve seniors care, which is critical, and we've learned in the pandemic just how critical and important and challenging it can be. Improve diagnostic and surgical care in our existing healthcare service, because people have challenges right now. A substantial investment in mental health and addictions, and a second hospital that's coming, that's being built. We're going through the RFQ and RFP process, and we will in the next year, a hospital that reflects the needs of people in Surrey. So all of those things represent, I think, a transformation in Surrey. And I want to say this finally, because we're talking here to a business audience. I think that healthcare and and technology is going to be a central part of the economy and business life of Surrey in the future. And adding a hospital, a state-of-the-art hospital that attracts healthcare professionals here, in addition to all the investment we're making at Surrey Memorial Hospital, is important to that. But I think there is a profound opportunity here to move forward on all of these things together, but also for the people of Surrey to become the center, an additional center, but a real center of healthcare in our province. And all of these investments indicate our commitment to do that. And most importantly, as Dr. Johnson has said, the establishment of a new medical school in Surrey. All of these will make healthcare a center of what we're doing in BC. So what are we doing? Surrey business plan approved, $1.66 billion, largest investment in a single hospital project in BC history. RFQ process going through with the city of Surrey, significant consultations with Indigenous peoples, RFP process coming up. I would expect construction to begin in 2023, because it takes a while to go through those processes, and the hospital will be open in 2027. That's all exciting news, and it reflects, I think, the central role that Surrey is going to continue to play in the healthcare and the economic life of our community. Finally, I just want to express my gratitude to all of you for your support in this extraordinary 18 months. Healthcare has never been more important to all of us, to all of our communities, to all of our businesses, but all of us as individuals, as family members, as brothers and sisters, fathers and sons and daughters and community members. And I want to express my appreciation to all of you for all of your support for myself, for Dr. Henry, and for our healthcare workers during this time of pandemic. I look forward to taking your questions, and thank you very much for having me today.
Thank you so much, Minister. My first question to you, as you know, during the pandemic, labor has been a significant issue for many industries. And even prior to the pandemic, we were facing labor and skills challenges. There's another 1.3 million job openings expected by 2030. What is your perspective on addressing labor needs as it relates to healthcare, nurses, physicians, practitioners, international partnerships?
All of it is the answer. I think all of the above and more. Just to put that in context, I told you, because we sometimes statistics are something I like the numbers, and I like to think about what the numbers mean for us, right? In the 18 to 59 population, the next 20 years in Surrey, we're going to see an increase of 34%. You say, wow, that's a lot of people, and it is, given the base. And as you said, Surrey about to become BC's largest city, right? But if you compare that 34%, which is the working population of the community, against the 239% increase in people over 80, who are by individual the largest consumers of healthcare services, right? You see the challenge, right? And it's not just Surrey. A community like Fort St. James, 179% increase in people over 75 in that community, and a net decline in the working population, right? So this is a challenge for our province. And so how do we do it? Well, first of all, we have to start, and you see this in the most recent budget, the significant investment in the training of nurses, the second medical school in Surrey, that's the training of doctors, but also significant increases in health sciences professionals around BC. And this is where I think having the best and the state-of-the-art hospitals, such as the one in Cloverdale, will be an advantage to us. Because you're right, the biggest challenge to public health care is not money, although we spend a lot of money in healthcare, as everybody knows. But that's a political debate, right? I mean, we can do that. We can decide to spend more or less. That's a political discussion. But the main threat to our public health care over time will be the ability to provide, to get staffing in place, right? To ensure that people have the care that they need and they deserve, right? And so that's why these investments are happening. And we have to, I think, take another look at the way we view healthcare workers as well, and the value of their work. And this is challenging, and it can be expensive. But when we put in place in the pandemic something called the single site order, it meant basically the healthcare workers could work in only one site in long-term care. We raised the salary of people. It was $165 million a year cost to the province, because we essentially footed the bill for that. We footed the bill for it. But that was the amount under the HEABC negotiated amount for care staff that people were being paid in year after year before that. And what everyone thinks of the debates around Bill 29 and everything else, and obviously I have a strong view on those debates and on the privatization and contracting out of healthcare and everything else, it is in a time when we need staff totally unrealistic to pay healthcare staff who are doing some very challenging work, poverty wages. Right? That's just not a plan for the future. So you have to be realistic. You have to say to people, we want you, you're 18 or 19 or 20, and this can be a family supporting job and so valuable to the community and so and so important. And so we've got to recruit a new generation of healthcare workers at every level of healthcare. And that's true across society. And the final thing I'll say is a thing about immigration, because we often have a debate. I'm 57. Right? And often if you look at public opinion surveys about immigration, older people are less open to immigration, right? Well, older people need healthcare more. Older people need a new generation of healthcare workers. Older people are going to need us to add to our complement of healthcare workers. People who want to come to this country and yes, be doctors and be nurses and be LPNs and be health sciences professionals and be caries and healthcare assistants, and provide home support and be ambulance paramedics and all the things that we do in healthcare. So we're going to need that, and we need to have a frank debate about that as well, about the need to ensure that we have sufficient working population to support not just healthcare, of course, but education and childcare, and then all of the opportunities that exist in this amazing province for economic development in the private sector, where the significant impediment to that right now may well be, which is ironic because we've been through a tough period, but the supply of qualified labor.
Minister, healthcare workers are obvious heroes during this pandemic. Do you see, and there's been a great level of anxiety, stress, mental health. Do you see a significant departure from healthcare industries, from hospitals, when we're seeing the pandemic edge out of our lives?
And this is, it's very challenging right now, I'd say, because two things happened in the pandemic. We had, of course, the enormous anxiety and demand of COVID-19, right? And we've seen the very significant demand, but not so long ago, it was April, there were 511 COVID patients in our acute care hospitals, right? At its height, 83 people in critical care, in addition to all the other things that our acute care hospitals face. And those two numbers have declined precipitously. I think it was 109 overall in hospital, which is still a lot, but obviously dramatically less than 511, and 47 in critical care as of yesterday. But what's happened in this period is that we are seeing a resumption of all the other things that healthcare used to do. And so the challenge for healthcare workers, and why we have to continue to support healthcare workers, on June the 2nd in BC, we had the third highest day of paramedic calls, of ambulance calls in the history of British Columbia. Day one, January 1st, 2017. Day two, January 1st, 2018. And we all expect that on New Year's Eve. I won't talk in business audience too much about New Year's Eve, but just say that this year, we had very few emergency room visits on New Year's Eve, and we should all reflect on that when we engage in whatever we do on New Year's Eve in future years, I think. But those are the two highest. The third was June 2nd, 2021, right? In other words, the resumption of activities and some of the challenge of the second public health emergency, which is the overdose crisis, which is borne by paramedics and acute care workers and people working in that whole sector, as well as, of course, the families and the people involved. 175 people passed away in the month of April. It is an extraordinary challenge to all of us. Increase back to normal in emergency room visits that we've seen. So it's not, the challenge is that healthcare workers have been through this extraordinary experience, this difficult experience, this profound experience of dealing and helping the whole community get through a pandemic. And we're now resuming the previous levels of healthcare demand. Healthcare demand in acute care was 103.5% of capacity on March 9th, 2020, prior to the declaration of the pandemic. We've been under that since then, right? Under that, because fewer people have visited. Our healthcare workers have done an amazing job in the last year, more surgeries than ever before in a pandemic. But now we're seeing also the resumption of a lot of other things. So I think for our healthcare workers, it's going to be a very, very difficult time from their own health perspective, because after this long thing, when a lot of us want to emerge from our shell and things will be better in the perspective of the reduction and the easing of restrictions, healthcare workers are going to have a lot more work to do, perhaps, on everything else but COVID-19.
Minister, we work so closely with Fraser Health. In fact, I think I spoke to Dr. Victoria Lee almost every day during this pandemic, but Fraser Health is such a huge area. Is there any consideration to redoing the boundaries, making it more manageable for citizens and workplaces?
First of all, Tom Zateric just flashed a question. 1.66 billion, Thomas, was the number that was approved. In terms of the current configuration of Fraser Health, I'd say no. And here's what I'd say. We have 6 health authorities in BC, plus the First Nations health authorities, so 7, right? And that has been an advantage. There are, I think, a couple of dozen in the city of Toronto alone, for example. And our configuration of health authorities has been an advantage, because we launched our emergency response in January 2020, before the pandemic, right? was named a couple of months before, but because of the advice of Dr. Henry and others, we launched it. And all the 6 health authority CEOs were on it and part of it all the time, as was the First Nations Health Authority every day. And that configuration is an advantage. We could all think of different and better configurations, but I would prefer to spend money on healthcare and not reorganizing health authorities. And I just say this as well, the current health authority model was put in place by the previous government, by the Liberal government in 2002, 2003, these 6 regions. And we could imagine theoretically if we were drawing it up, you know, and we were doing a session with the Surrey board and we were drawing up, well, what would be a better configuration? We would probably find one, but there are costs to that, right? And I think the folks at Fraser Health, Dr. Victoria Lee and our teams, you know, Fraser Health is the health authority that faces the most extraordinary challenges of all. It's the largest health authority. It's the largest employer in BC outside the provincial government. 30,000 employees in Fraser Health, the diversity of the communities, the number of communities, the fact that we see population increase at a time when there were relative cuts in healthcare services at different points in the last number of decades. And so Fraser Health has all these challenges. I think they've done a really exceptional job under those circumstances. And I hope that the work we've done together with the business communities, with municipalities, I want to thank the City of Surrey, Mayor McCallum and everyone on council for all that they've done. Linda and Brenda and Stephen, I know are here. I want to thank them as well. I think that if anything, Fraser Health's become better connected to the community during this. Unfortunately, of course, during this time of pandemic, but I hope that we can build on that and that this hospital project will not just be Fraser Health project, but our project, meaning you'll think of it as your project and the Cloverdale Chamber is their project and Mayor Walker is his project, although we got a big one at Peace Arch happening right now, and that change will happen. So the answer is, I think you can find a better health authority model, but I don't want to spend the next 3 years working on that when we've got more important things to do.
Minister, you mentioned that 1/3 of Surrey's population is under the age of 19, but many pediatric services are in Vancouver. What are government's plans to invest in pediatric services and medical services in Surrey so that we can live, work, learn, and play and ensure that our families are taken care of as well?
I think you're right. It just shows how sometimes we make decisions decades ago and the circumstances change, right? That's why we're investing in the second hospital in Surrey, which will help provide some of those services along with Surrey Memorial. Why we need, and this is important in terms of maternity care, we're developing with all of the divisions of family practice in the Surrey Delta area, a new primary care network to significantly invest in primary care. Because a lot of what we need in terms of maternity and pediatrics is not hospital care per se, although that's important, but support in the community for families. When we developed the primary care network in the Tri-Cities, because of the nature of that community, we invested significantly in our primary care network there, in pediatrics and maternity and so on. And that is, I think, what we're going to see as we develop that in Surrey as well. You're right. I mean, if we were building Children's Hospital today, it wouldn't be where it is now, right? It wouldn't be where it is now. It wouldn't be in the west side of Vancouver. There are relatively few children, actually, and relatively low density, right? But we're not also going to, can't be irresponsible about this. We've built that physical infrastructure. It's there. The people of the province have paid for it, and it's going to continue to be there. But you're right. We've got to find ways to bring healthcare services closer to home. We do that in Surrey by investing in primary care significantly, investing in our hospitals, adding the second hospitals, but investing in primary care. And that's what you're going to see in Surrey. Because if you were building a new children's hospital today in the province, of course it would be in Surrey, because that's where the development is. But these hospital projects are going to see and respond to community needs, and those community needs, and that's the voice of the community and in the services provided in our hospital projects, and why it's so important with the second Surrey hospital.
I mentioned just at the top of the meeting, the Canada India Network Society. They hosted the Canada-India conference, healthcare conference this past weekend. Will the new hospital allow for an innovative approach to care, especially for chronic disease in a community setting, the engagement of prevention, because healthcare costs to the BC budget are so significant. And we, in fact, are starting a healthcare and economics committee together later this fall to really bridge all of these pieces for advocacy projects in education. Tell us your perspective about prevention, chronic care, disease management.
Well, as my friend Dr. Garg knows, I have type 1 diabetes, so I live that life, right? Every day. I inject with insulin 4 times a day. And there's 2 things we have to remember about chronic disease. One, it's closely linked to our circumstances, economic, educational, social circumstances. So someone with type 1 diabetes who has a loving family and a good job, right? And who never goes, and while I drive an old car, as everybody may know, who knows me, 2002 car, I don't go, when I go to the grocery store, I don't choose whether I can buy a whole fruit or not, right? Which is better for me than buying the liquefied calories, for example, right? So we have to address social determinants of health, and those are important factors. And particularly for people with chronic diseases, the changes we've made in deductibles for pharmacare are really important, I think. And all the steps that we're taking to reduce inequality in our province and provide opportunity in our province, both in the public sense and in the private sense, are really important for all of that. So social determinants of health are important. I think Dr. Garg would agree with that. I think the hospital is important for that, but I don't think it's the primary place where we deal with chronic disease management. When I was diagnosed with type 1 diabetes, I went into the hospital. I was stabilized. Your blood sugar at the time was supposed to be between 4 and 7. Mine was 43, which is higher. And so I went into the hospital for 2 days, was stabilized. And then what happened after that? Well, I haven't been back to the hospital since, right? In the decades that followed that. Because of the support I got in primary care, I was well trained by what they used to call a diabetic nurse. I took 2 days of programs. I learned how to self-manage, and I got the support I needed. And so when you're talking about chronic disease management, we're really talking about things in the community. The initiatives that Dr. Garg has launched at Hindu temples and at gurdwaras to improve and change the quality of food we eat, right, in those places, to make them healthier and some cases less caloried, I say. I say cautiously, having eaten many of them, but as someone who counts their calories every day, that's important, right? So primary care and chronic disease management is everywhere, but it's primary care supports. It's more nurse practitioners who provide a higher quality of care, and we're increasing by 2/3 the number of nurse practitioners we train every year in the province as a result of that. But it's all of us coming together to create healthy communities as well. And all the other things that are linked to that, including and especially in Metro Vancouver housing. So I think what we talked about at that conference this weekend is the need to deal with healthcare before people enter the hospital doors. And that's an essential question. And that's, I think, at the center of what Dr. Garg was talking about. Once people get into hospital, of course, we have to provide excellent care. But that's not the centerpiece of community care. We've got to live healthier lives to allow us to live better wherever we are. And this is when you think of that new generation of elders that's coming to Surrey, in large numbers, 239%. Can you imagine it? The transformation. We have to create a community that's friendlier to our elders. Things like public transit are important, and seniors housing and long-term care. All of we've got to create, it's a challenge for us because it's a different community than the current community in Surrey. Surrey will invent and reinvent and reinvent and reinvent itself in the next 20 years. And one of the most important ways it'll do that is the decline in the relative share of young people against the overall population. 14% of people of that population growth will be people under 20 in the Surrey local health area, and an increase in the number of elders, and what that means for our society and communities, both economically but also socially in the way communities function. We got to become more elder friendly, and that means a lot of the things that Dr. Garg was talking about and the panels we're talking about this weekend, but also addressing social and economic issues as well.
Minister, we have the most number of newcomers that come to Surrey within British Columbia. And over the years, through our workforce development work, people from different parts of the world, they're trained in the medical field, but they can't get a job here because of foreign credential recognition challenges. How can we work to improve that? It's been a prevalent issue for years, actually for decades.
By working to improve it.
Yeah.
I think that, and that involves significantly the federal government in those areas, right? And so both in the matching of our immigration policy to people's opportunities, I think it'll become, I think some of the debates we've had around these questions over time, because of course it goes without saying we have to maintain standards, particularly in the health professions. It goes without saying that we have to do that. But I think a lot of the discussion we've had in the last 20 years will seem like an anachronism in about 10 years, right? When these questions will be dealt with differently. And we have to move towards that, working together at the government level to do that, working with the colleges, the health professional colleges, which we're engaged in a significant reform of right now, and just understanding the value and maximizing the value of people in a healthcare system where we need people. It means expanding the scope of practice of existing health professionals and workers so that they can do more. And you think of the immunization effort we're doing now. It involves ambulance paramedics and firefighters, dental hygienists, right? And people who've been laid off in the airline industry who are supporting us there, right? And of course, health science professionals, pharmacists who have done an amazing job in community pharmacy in our AstraZeneca effort, and who support our clinics, nurses and doctors and everyone else, right? So we need existing people who work to the maximum degree of their skills, because we've spent an enormous amount of time training people, and sometimes it's ridiculous the limitations on their ability to perform their practice in our system. And we also have to address one by one these credential issues. And people talk about it all the time, but we've got to take a very practical approach that maintains standards. I'll give you one example. Previous government, Terry Lake was the Minister of Health, increased the standards essentially for carries, made it more difficult for carries to go from other provinces to BC, right? And they did that for good reason. At the time, I mean, I didn't comment on the time I wasn't a health critic or wasn't involved, I probably would have praised them for doing that, right? But a couple of years later, we found that impeded the movement of healthcare workers, particularly in the border with Alberta, but across, impeded at a time we needed healthcare workers, people who are longstanding healthcare assistants in other provinces, impeded them coming here. And so what do? We work together to change it. And that's what we have to do piece by piece. And we have to understand it's in our collective interest to do that. It's the right thing to do, but it's in our collective interest to do that as well. So we got to work step by step. I like to give fewer speeches on that and more action to make it better for people.
My final question to you is, what's your perspective on vaccine passports?
Well, we've built, and people will see this, I think, excellent registration system for vaccine in BC. And I think it's the first time in my memory we've gone live with a system that actually didn't receive massive problems on its first day, and we were very happy about that. And we've received extraordinary support from TELUS, and who've operated our call centers and done an unbelievable number of calls. But the value in that, our job in that, is to give people agency and power over their health records. So we've built a system that wasn't just designed for the registration of vaccination, but was designed, and we'll be laying out this and showing this soon, to giving people access to their own vaccine records, right? When you got your vaccine, what it is, not just for COVID-19, but for other vaccines. And so I think that in all of those areas, we've set ourselves up well. The importance there, though, is we have to be conscious of is protecting the privacy of people. And there's a question there, and we're also working, obviously, for people who receive their vaccines elsewhere to integrate them into that system now, and that's being done to assist in second doses, and that will happen as well. But I think that's an important thing, because what we want to do is give people agency and control of their health information without allowing, and this is a challenge, people to have information about our health information, which is our health information. So it's an actual balance. And while it doesn't seem as important right now to protect people's privacy, it's important. Your privacy over your health records and your circumstances is important. And it's important to us as well, because if people don't feel confident that the healthcare system will protect their privacy, then they're not going to share with us, and we need them to share with us. And if anything tells you why that's important, it's the contact tracing we've done for COVID-19, where we're asking people to share in a difficult time. And you've got a test positive case of COVID-19, and then you have to say where you've been and who you've talked to and contact them and all that thing. And people have shared with us, and they've shared with us because they trust us. And that trust is important. And a lot of the debate about data and its release is that context we want to provide, the maximum amount of information and protect people's privacy. With respect to vaccine passports, I think, what I'd say is this. One, I don't think there should be a vaccine passport for services in BC, right? So I don't think that's where we want to be. Because I think, and I believe this with all of my heart, that we need to convince people to get vaccinated in the largest numbers possible. And I think we're going to succeed in doing that, and we need more. It's 1-833-838-2323 or the Get Vaccinated website. Do it today. We need to do that. But we shouldn't limit people's or create a circumstances within our province where people are denied access to services, or to push these issues, which are healthcare issues, into the courts, which inevitably happens. So and this was the same, by the way, position we took in 2019 when there were 29 measles cases with young people in BC. And we took the view that we wanted to expand immunization, and we did. We had an enormous amount of success with that. So we don't want to do that, but we are practically going to have information for people so that they can travel. And whatever form that takes, and we're working on it with the federal government as well, because this is primarily their area of jurisdiction. We have the information, we've developed information that will be usable for that purpose, and we have to work through so that people have the opportunity to travel. And a lot of the issues, I heard something about a Bruce Springsteen concert in New York, and it actually affected some people who wanted to take AstraZeneca. They thought, well, we're not going to be able to see the boss if we took AstraZeneca. These issues that issue was worked out within 24 hours. Some of the stuff is new, but I think we obviously need to have the capacity as people come into our country to ensure that people are appropriately vaccinated, right? And as people leave our country, other jurisdictions are going to expect that. And I'd just say to everyone in our audience who may not think they want to get vaccinated, if people think other jurisdictions are going to allow you in unvaccinated any more than they do already, I mean, we need vaccines to go to many countries in Asia right now. We've always have, right? You have to be vaccinated. And if anyone thinks that's going to change, or that people are going to be able to travel unvaccinated across this big wide world, they are wrong. And we have to create the means for them to do that. What that takes, that's something we're working through with the federal government. There are complicated questions, but I think we're going to arrive at something that works for people.
So, ladies and gentlemen, the key message there is to say yes to your first and second vaccination so that we can be fully immunized, so we can have consumer confidence and full economic recovery. British Columbia is actually doing better than any other province or territory in Canada from an economic perspective. And Minister Dix, thank you for your service to our province, to our communities, and to our businesses, to our workforces, and being there every single day during this pandemic. Ladies and gentlemen, thank you for being with us. Thank you to our presenting sponsors, Simon Fraser University, and please join us tomorrow as we welcome the BC Minister of Education, Jennifer Whiteside, and the Minister of State for Childcare, Katrina Chen. You may please make it a great business day.